Dr. David Klein joins us on the microphone right now, and we're going to talk about sexual health and aging. Do you mean to tell me it all doesn't stop at the age of 50?
Well, I'm one good example with why and how it doesn't. Okay, my dad, when he passed away at 92, when offered, Pop, can I get you some Viagra? His response was, hell no, that's for old people.
Oh, boy.
All right? Well, it works a little something like this. You know, you can age, which is a joy and a privilege because many of your friends didn't. They didn't make it. You know, the first deaths that I experienced were in elementary school. People die. That's the way that it goes. So growing older is a privilege. And it comes with some cost, aches and pains, miseries. But they don't necessarily need to knock you out of the bedroom, or at least as an active participant. And that's what this is all about. Okay? As you get old, you don't necessarily need to get older. As you age, you don't need to become old. It's all a matter of form and function. So what are we going to talk about? What we're going to talk about isn't sexually transmitted diseases. Those of you that have them, you know you've got them. Do we fix them? Yeah, but it's not going to necessarily mean that you want to stop participating. You should probably, at least until we can clean it up. But nevertheless, what we're looking at here is why do things work? Why do they stop working? And more importantly, what can you do to prevent it and or get things going again? Now, if you're looking at men and women together, the more complicated machine is the woman. Go figure. This is not something that comes as any huge surprise to guys. Guys are easy. You give them a bowl of food, you give them a place to sleep, and they're happy for the most part. Women, on the other hand, much more complicated. You know, that's life. It's always going to be that way. I love it. It's a challenge. So with women, what happens with their sexuality? That is something that can be corrected. And it's not necessarily what you think. Okay, everybody and everything in medicine has to be seen in context. And with sexuality, it's a matter of balance. Balance is wickedly important. You can have the best looks in the world, but if you have no machine behind it, you're of no value. You then become an observer. Okay, if you like watching things and so on and so forth, that's fine. But if you want to be an active participant, you have to look at the basic parameters. Basic parameter number one for women, oddly enough, is estrogen level. Now, there are 3 different estrogens. Wouldn't you know it? Estriol, estradiol, and estrone. You need all 3. Okay? That's just the way that it goes. But it's taken in balance and context. So as women get older, their estrogen level is about the last thing that goes to 0. First, oddly, is progesterone. Progesterone goes to 0, and then they become estrogen dominant, and they become, in the vernacular, bitchy. Things start to go to hell in a handbasket, can't get along with anybody, so on and so forth, comes and goes. And for the most part, unless they're irrational to begin with, they realize that these are temporary bouts of insanity. But it's a progesterone issue. The next thing that goes is testosterone. Now you've got somebody, the progesterone goes away, they're angry women, but they have no libido, or they have the inability to climax, or they have the inability to do other sorts of activities, because testosterone is every bit as necessary for women as it is for men. The last thing that goes is the estrogen, and when that happens, you are the little old lady at the community pool with nothing to do and nobody to do it with. So how do you handle this with women? First thing you want to do is to check the blood work to make sure that everything is intact. And it usually is not, okay? That's the way it goes. When do you start seeing problems with women? Right around the age of 16. As it turns out. Okay, so it can happen early in life, it can happen later in life, but it inevitably happens to all of them. So what are the symptoms? Hot flashes might be number 1. Vaginal dryness might be number 2. Let's say urinary incontinence might be number 3. You cough, sneeze the wrong way, and you pee on yourself. That is not normal. Is it treatable? Absolutely. Is it easy to treat? You betcha. We have tricks for that. But then comes the sexuality, the libido, and so on and so forth. So without knowing what's going on, you are going to fail with this. So we check blood work. Okay, what's the libido hormone? It's called DHEA. People can take it. You can go get it at the health food store, but you better know how much to take. The only way I know to do this is through blood work. Intelligent, regular comparison blood work to make sure that you're doing the right thing at the right time, with the right medication, in the right combination, with the right ratios. Very, very important indeed. There are tricks that we can do to fix urinary incontinence. Well, one of the worst things that a person can do when they're getting ready to have intercourse, or if they're in the middle of it, is to pee on their partner. That will kill libido like just a rock falling through a plate glass window. It's the way it's going to go. So you got to take care of that incontinence. How do we do that? Procedure called Votiva, easily done. 20-minute procedure. You do it 2 or 3 times, done for under $1,500. It fixes the incontinence. What else does it do? It makes everything a little bit more inviting down below by increasing vaginal mucus secretion. You need to make sure that the progesterone levels are adequate. Testosterone, estradiol, all of these things can be done through creams applied to the skin. Cost per month for our patients is about $30. So $30 a month, you start restoring the HRT. Okay, most doctors that, when they send them to the compounding pharmacist, it's over $100. I cut a deal with my compounder, so it's $30. Makes everything a little bit more affordable. Libido. How do you kick up libido? By gently edging up the testosterone. You do this with a cream. So 4 hormones, 1 cream, $30 a month. Pretty impressive. But there are those times in a person's life when they need a little extra something to get them going. What could it be? It could be a glass of wine. What could it be? It could be a box of chocolates. It could be roses. Or it could be a bottle of Tribulus. Okay? You take 2 or 3 Tribulus tablets, capsules, whatever, and wouldn't you know it, I'll start looking attractive to you. It works. Okay? So women, it takes a little bit of finesse. Guys, on the other hand, are easy. Okay, very linear. What's my testosterone level doing? Okay, fine. We will deal with that. But what knocks a guy out of the batter's box, as it were, okay, is estrogen. As a man ages, his estrogen level goes up, and it doesn't seem fair that it should be this way. But by the age of 40, the average guy has a higher estrogen than his wife. Now, what does this mean? It means they make less of a husband and more of a bridge partner. You have got to take that estrogen level down, and this is an easy thing to do. We use a product called Stud Mix. It increases testosterone, lowers estrogen, so you get 2 bangs for your buck with this one, if you pardon the metaphor, and diendomethane product called No Mo Whining, and I mean no mo whining. Okay, guys tend to whine. They tend to become a little bit more like the daughter by the age of 45 or 50. Things stop working. They start waking up in the middle of the night to urinate. Okay, so there seems to be a common thread here, and it's called pee, urination. Either you cough and pee on yourself as women do, or you wake up in the middle of the night to keep yourself peeing the bed. Okay, either way, these are sexual issues. Okay, if you can't take care of your wife, somebody will. So you got to go out there and get this thing done. Do you necessarily need Viagra? Some men do. Many men take it really for fear of failure. Okay, and that happens. You take 50 milligrams or 100 milligrams of Viagra just so that you know that you're not going to let your partner down, as it were. Okay, that's perfectly reasonable. Okay, fear and panic are very much the same thing when it comes to a guy's sexuality. Fear being the second time, it's the first time he can't do it twice, and panic being the second time he can't do it once. You have got to get this under control. So sexual health, very, very important. And then the last thing I want to discuss is your looks, because it doesn't do you any good if you can't get a second date. Now, customarily, you're not supposed to give it up until the 3rd date, but if you can't get a second date, you are not going to get lucky. Okay, so what do you do about your looks? Okay, well, I'm not God, for God's sake. Okay, so what do? First thing you want to do is to make sure that you lose some weight, make yourself look a little bit more attractive to the other person. This is important, especially if your partner, your life partner, passed, you got divorced or so on and so forth, and you're looking for number 2, in some cases number 3, 4, or 5. So you need to make sure that the subsequent persons are interested. It's very, very sad when you hear about people that can't get a second date. Well, when you're in your 70s, that happens. My patients, they tend to get a little luckier for a number of reasons. Okay, one of which is when you are back into function, okay, the reputation gets out, so it does work. Hey, Miriam over there, she's a hot number. You'll get dates. You don't do what you need to do, and it can't work. You're going to be a second date. You've been a second date Sahara. It just doesn't work really, really well. So, with regards to other bits of appearance, we have procedures that we can do to make yourself look younger. You can dye your hair. I don't need to worry with that. But getting the wrinkles out of your face, getting the wrinkles out of elsewhere, we do that at stages of life. We're very, very effective at it, and it doesn't involve the knife. It does not involve cutting through skin. It does not involve poking a probe through and burning from the inside out. What it does is it tightens the skin. It's almost like having a chemical facelift without the chemicals. Very interesting,
Nice.
Very cost-effective, no downtime, and we, too, can make you feel younger and look younger, and then maybe you'll get lucky.
Hey, here's contact information for the stages of life.
Our phone number is 407-679-3337, and our website is stagesoflife.net. We're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And let's see, our office hours are Monday through Thursday, 8 to 5. The health store that Rob mentioned with all of our nutraceuticals is open during those office hours, but we're also on the web, as I said, at stagesoflife.net, and you can purchase your nutraceuticals at your leisure, and we will ship them to you.